Well, hello. Welcome, everybody. Like Joanne was saying, we're so excited to have you on, and I'm really excited for you guys to hear this information Joanne is presenting tonight. She's such a blessing and wealth of knowledge, so I'm really excited. So thank you for being here. Tonight, we are going to talk about Nrf2 activation and endogenous antioxidants, our objectives for you. Be able to make sure we hit on describing Nrf2 activation and health benefits, to be able to focus on the endogenous antioxidant enzymes, list some endogenous antioxidants enzymes and their functions, and try to make sure that we know how to actually use those in our strategy and our lifestyle, including Mediterranean diet, supplements, and fasting as well. Some of the hot topics that are going on today. Many of you guys probably know Joanne. She probably doesn't need an introduction, but she's amazing, and we want to kind of, like, Joanne, I was looking through your bio, and it's just amazing, all of the fun things you've had throughout the years and just different cool blessings that you've been able to do. She is a registered dietitian, and she has had over 40 years of experience in her field, working with clinical care, public health, nutrition, diabetes, self-management, food and nutrition management, one of the pioneers to help incorporate the Mediterranean diet into the clinical setting in hospitals, supporting healthy food culture. Also one of the pioneers with the glycemic index for diabetes management, just so many cool things. She's also held several leadership positions in the Academy of Nutrition and Dietetics. You may know her from some of those as well. Currently, years ago, she retired from the Heart Hospital in Avera in Sioux Falls in 2011, and now resides in sunny and beautiful Arizona with her husband Jim, and they like to play pickleball and spend time with friends and travel the world and enjoy that time. So how cool. Tonight, she's going to present her topic that we're talking about for Nrf2 activation, and afterwards, I will be sending out a certificate within the next 24 hours to you guys that includes the certificate as well as the recording. The recording will be available for about 10 days. If you want to go back to it and listen to certain segments again or the whole thing or anything, just kind of a good resource to have available. Throughout her talk, if you guys have questions that pop up in your mind, feel free to just drop those in the chat box, and then we'll do questions at the very end. So just drop them in when you're thinking about them, and we'll hopefully get to them all, but we're going to try to keep the whole presentation to an hour. So with that being said, I'll give it up to you here, Joanne, and keep cruising along. But thank you so much for being here and giving us your knowledge. We appreciate it.
Thank you, Sarah. Thank you. Thank you. Welcome, everybody. I'm just so grateful to see so many of you hopping on and learn about this topic that I'm quite passionate about. I'm going to be sharing with you what I've learned about over the last 9 years about Nrf2 activation and endogenous antioxidants. I'm not a researcher, but as you can see, I'm kind of a lifelong learner, I guess you might say. I turned 70 this last year, and I'm trying to keep my brain really working well and keeping my brain active. So I'm trying to do that. So I'm really excited to be able to present to everybody tonight on this topic. And so here's our objectives. We're going to describe Nrf2 activation, multiple benefits of activating Nrf2, with that focus on the endogenous antioxidant enzymes. So I'll list some of those powerful endogenous antioxidants and talk about their many health benefits. And then you will learn what you need to do and what we can do in lifestyle strategies to increase Nrf2. So we're going to learn a lot about Nrf2 tonight. So when we're talking about antioxidant enzymes, we're talking about Nrf2 activation. We really need to have a great foundation in oxidative stress. So let's talk a little bit first about what is oxidative stress. Oxidative stress is the leading theory on why we age and we get the diseases of aging. And oxidative stress is the imbalance between too many oxidants and not enough antioxidants. And what are those oxidants? Those oxidants are reactive oxygen species, a very highly toxic molecule in that free radical category. And just to give you an idea about how much interest there is In oxidative stress, last time I looked at PubMed.gov, there were 220 research articles on oxidative stress. When I'm talking to the clients, the layperson, when I'm trying to describe oxidative stress, I tell them oxidative stress is literally the rusting of the human body from the inside out. Another way to describe oxidative stress when you're talking to your clients would be, like an apple. When an apple is cut and sits out on that countertop, it turns brown. That's oxidation on that apple. Well, that is what's going on inside your body. Okay, a little bit more about these ROS molecules, reactive oxygen species molecules, highly reactive. They really do destroy everything that they bump into your cells. But actually, at lower levels, they actually have some vital functions. One of the things is I like to think about it is I think that at lower levels, they actually make our cells stronger because our cells kind of have to fight back, right? So they're involved in functions of cell signaling, communications, homeostasis. But when our antioxidant defenses cannot keep up, then they have damaging effects at higher levels. Cellular death, apoptosis, lipid peroxidation, inflammation, and damage to DNA and mutations in cancer. So where do you get the free radicals or these ROS molecules? A lot of sources. Well, first of all, you do generate some within your cells, right? That is from a metabolism of glucose within the cells. You get some free radicals. The way that I explain it, to my clients is that it's really like the exhaust in your cells. That's where you get some of those free radicals. Well, the other way that you get free radicals is from your environment. And I think this is what really concerns most of us, right, is our highly toxic environment. So sources of free radicals are cell phones, UV rays, EMFs, pollution, chemicals in food, herbicides and pesticides, intensive aerobic exercise, low-level exercise not so much, but very intensive, like elite athletes have can have high oxidative stress. Fuels, for example, and biofuels. And how about cigarette smoke? Cigarette smoking really generates a lot of oxidative stress. And this is why cigarette smokers age 10 years faster than non-smokers and get the diseases of aging 10 years sooner, right? So talking about aging, oxidative stress is associated with more than 200 chronic diseases of aging. In other words, free radical damage, oxidative stress is the common denominator of just about every chronic disease that you can think of. This is why there's so much interest in oxidative stress and what we can do to lower our oxidative stress. A lot of interest in, lowering oxidative stress when it comes to the brain. And all kinds of brain disorders. And, another thing too is to keep in mind is that generally with oxidative stress and inflammation kind of run together as bad apples, because when a free radicals damages a cell structure, that activates your immune system, because your immune system is trying to, destroy the free radical and to try to repair the damage done. So that activates the immune system. So a little bit more about how free radicals work. This little diagram shows an oxidative reduction redox reaction in a typical reaction here. So the free radical is this unstable molecule lacking electron in the outer ring. The antioxidant comes along and it donates that electron, or it steals it, whatever way you want to describe it. So then the antioxidant becomes oxidized and the free radical becomes reduced. Now, one concern that there's been with giving high amounts of direct antioxidants in supplements, very high amounts, is that you can see is that, that what happens when you have this these oxidized antioxidants floating around in the bloodstream. Maybe that's not a really great approach at how to lower oxidative stress. So there are two sources of antioxidants. We are quite familiar with the exogenous ones that are also called direct antioxidants. We have another source, that is your cellular antioxidants. Those are your endogenous antioxidants, or indirect. So let's look at, first of all, the direct antioxidants. All the antioxidants, foods and supplements, they neutralize free radicals in a ratio of 1 molecule to 1 free radical. It's what I call the one and done. But your endogenous antioxidant enzymes are huge molecules. And if you remember back from your biochemistry, and that is that these enzymes, they're catalysts, right? They don't get consumed in the process. So they keep going and going and going. So they are also very large molecules. And even they can even recycle themselves. They can, like glutathione, it can recycle from oxidized state back to the reduced state. For example, 1 molecule of superoxide dismutase, SOD, will neutralize 1 million free radicals, right? And you're going to learn that they're 1 million per second every second, probably. They just keep going. Just a really potent, powerful way to handle this oxidative stress is by your endogenous antioxidant system. So let's talk a little more about some of these endogenous antioxidants. What are they and what are the functions? First of all, SOD was the first antioxidant enzyme that was discovered by Dr. Joe McCord from Duke University and his preceptor, Dr. Erwin Fridovich. And it was quite the discovery. They discovered it and they weren't quite sure what the function was of superoxide dismutase. And so they went on this journey, found out that it has a whole range of health benefits. Well, first of all, it destroys superoxide, a highly toxic free radical. And in the process of doing that, it also can repair the damage that's done to the cells. So this SOD, it's not only kind of like the catalytic converter in the car, going in and cleaning up the free radicals. It's a little bit like sending the mechanic in too, right? With SOD, goes in there and does some repairing too. It also has anti-inflammatory benefits and anti-cancer benefits. And this is really a new development with SOD. They found that 20% of ALS patients have a genetic deficiency in the gene for SOD. Another health benefit is reducing free radical damage to the skin. And it's also, SOD is being studied intensely in benefits for inflammatory bowel diseases. Catalase, another one. It converts hydrogen peroxide into water and oxygen. And we know hydrogen peroxide is very toxic to cells, converts, and see how powerful it is? 40 million molecules of hydrogen peroxide to water oxygen each second. Wow. We don't hear a lot about catalase. It's not really a supplement that we take, and we don't hear a lot about it, but it's really used in the food industry. And also in food wrappers, prevents food from oxidizing, used in skin treatments. And I found this little tidbit. I thought it was interesting. Maybe that deficiency of catalase, well, maybe it might lead to bleaching of the hair, graying of the hair, right? Bleaching of your hair from the inside out. So I think starting about age 50, or maybe 55, I started developing a little catalase deficiency, right? I have a little more going on right now. So then we have heme oxygenase 1, maybe one that you've not heard about before, but it's sure getting a lot of press lately and on PubMed.gov, you see a ton of articles on it. Why? Because it converts heme, which is really toxic, it's a pro-oxidant, into 3 very benign beneficial compounds: biliverdin, ferrous iron, and carbon monoxide. There's a lot of interest right now from pharmaceutical companies in trying to develop an heme oxygenase 1 drug. Why? Because the benefits are really significant. They have benefits for reducing risk reduction of neurodegeneration, carcinogenesis, atherosclerosis, autophagy, and inflammation. Again, inflammation. That's what you'll hear over and over again as we're talking about these antioxidant enzymes. They all have one common function, is definitely lowering inflammation. Now, glutathione, my favorite of all, I think. Glutathione, oh my gosh, I just looked again at PubMed on the number of research studies on glutathione. 151,000. Unbelievable. So much interest in glutathione, and for a good reason. I've seen, I think it was Dr. Mark Hyman called it the mother of all antioxidants, probably the most important antioxidant in your body. It's a master detoxifier, especially for heavy metals and xenobiotics. That is really something that is critically important right now, right, with our environmental toxic exposure. It's essential for phase 2 detoxification of your liver. Important for cancer prevention, provides immune support, improves insulin resistance, and there's a ton of interest in glutathione in Parkinson's disease because it provides significant protection, neurological protection for the brain. Now, glutathione, how do you, it's wonderful. And I think every one of us, we're going to want to say, yes, 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 I want more glutathione. It can't be taken in a pill form because glutathione is, it's very unstable. Even if you do get it absorbed, and not much is absorbed because it's a protein and it does get digested. But even when it gets to the liver, it gets degraded very quickly. So oral, they've found that taking it orally doesn't work. They've been giving it by IV infusion. There's a great, wonderful little video at YouTube that I found with Dr. Perlmutter was giving IV infusions to a patient with Parkinson's. And he had this really impressive reduction in his symptoms within 30 minutes, but it was very short-lived because there's a very short half-life of glutathione when it's given by infusion. There are some precursors. There's a supplement in acetylcysteine that can increase glutathione in the serum. I just found a study that's hot off the press. Well, I wouldn't say it's not that, well, 2018, published in the American College of Clinical Pharmacy. And they were looking at the increase in the of NAC in both plasma and in the, looking at increase of NAC in the brain, and ability to increase glutathione as well in the brain. What they found that NAC did increase the plasma levels of glutathione, but it did not increase glutathione in the brain, and it did not decrease oxidative stress. So it looks like maybe N-acetylcysteine, NAC, maybe has some very limited benefits with increasing glutathione, particularly in the brain. Well, there is another way and a more potent way to really increase glutathione, and that is through Nrf2 activation. Nrf2 activation activates 3 key enzymes required for glutathione synthesis. Nrf2 activation, what is Nrf2? Nrf2 is a cap and collar transcription factor. What is a transcription factor? It's a protein that binds to DNA and regulates gene expression, controlling the rate of transcription of genetic information from DNA to messenger RNA. Nrf2 modifies a number of genes, 250 to 600, depends on where you read and which researchers, give different amounts, downregulates and upregulates genes. So let's look at some of the genes that are modified by Nrf2. Look at this, upregulates 23 genes involved in antioxidant production. SOD1, SOD2, glutathione, catalase. Upregulates 25 genes that encodes for an enzyme essential for detoxification of xenobiotics. The researchers from Washington State University, Dr. Paul and his associates, they reported that Nrf2 has a wide range of detoxification effects, producing increased resistance to toxic organic xenobiotics and toxic metals. Now, this is gene modification, and it downregulates and upregulates these beneficial genes, and it downregulates a number of awful genes, those pro-inflammatory genes, inflammatory mediators. These are all lowered by Nrf2, and it downregulates a number of probiotic genes as well. So here's a little bit of the biology of how Nrf2 actually works. When the cell is under a lot of stress, or if you have a Nrf2 activator within your diet and that goes to your cells and you have a Nrf2 cellular activator, what that does is it activates a protein called KEAP1. Because Nrf2 is bound in the cytoplasm to this other protein that makes it, so you have this complex of KEAP1 and Nrf2, right? And so when Nrf2 gets activated, then that releases the Nrf2 and it travels to the specific strand of the DNA. That specific area of the DNA is what it attaches to is called the antioxidant response element. And it attaches at that specific location. That's where you get the upregulation of all of those wonderful, great survival genes that produce all those antioxidant enzymes, downregulating those profibrotic, pro-inflammatory genes. Okay, so again, the way I describe it to to a layperson is that the KEAP1, basically what it's chained up, and Nrf2 activation is like the bolt cutter that comes along and it unchains it, right? So that Nrf2 can get into the nucleus and get down to the level of your genes and do the work that it's designed to do. So there's a lot of research on Nrf2, and if you go look at pubmed.gov, I think you're going to find somewhere around 15,000, 16,000 research articles. Research started coming out on Nrf2 in about 2005. So in the world of research, this is fairly new. Maybe you've not heard of it before. Researchers have called Nrf2 a number of things. They've called it the master regulator of the body's stress response, pathway in the cellular defense mechanism. Dr. Paul and his researchers call it the master regulator of detoxification. Now, this is from Dr. Lewis and his associates at the University of Texas Health Science Center. In their paper, they state that Nrf2 is a signaling pathway, and it's emerging as a critical principal factor in the protection against cancer, neurodegeneration, and inflammation, and plays a pivotal role in determination of longevity and the health lifespan. Again, Dr. Paul from their paper, this is a fabulous paper, by the way, and if you'd like me to send this out, maybe Sarah, we could attach this paper. I've got the full text of it because I think this is a must read, this paper. I think it'd be incredible interest to dietitians. They say, look at the title of their paper, Master Regulator of Detoxification, also antioxidant, also anti-inflammatory, other cytoprotective mechanisms. And they say that Nrf2 may become the most extraordinary, therapeutic, most extraordinary preventative breakthrough in the history of medicine. Well, again, like I said, 14,500, I said 15,000. It's growing every day. There may be 15,000 there now. Didn't look today. But look at the number of different diseases where Nrf2 is being researched. Pretty impressive, all of the research in the area of Nrf2 and different diseases. Okay, so we talked a lot about lowering oxidative stresses. As you understand, we've got all those potent antioxidants, right? And Nrf2 is going to increase the production of those antioxidant enzymes. But lowering oxidative stress is just the tip of the iceberg of the benefits of Nrf2. We're already talked about detoxification of heavy metals, right? Because you're going to get increased glutathione, downregulation of those pro-inflammatory genes. We talked about that. It protects against neurodegenerative diseases, cancer, cardiovascular disease. How about this one? Promotes healing after traumatic brain injury. That is really, there's some really great research going on in Nrf2 and traumatic brain injury. How about this one? Nrf2 targets all 6 intertwined pathways that cause depression. So there's a lot of interest in the pharmaceutical world in coming up with a Nrf2 activator for depression, because normally, those 6 different intertwined pathways, you find that your patients will get on like what, 3 different antidepressants because they all target something, a different pathway. Increasing exercise endurance and recovery and boosting the mitochondria. Lots of benefits. I call it the delightful dozen benefits, and I think there's even more, but those are the key ones. So I think by now you've probably understand that activating Nrf2 is becoming a really, really hot topic in the research world, in science, and in nutrition. So what can we do to increase Nrf2 activation? Well, how about the Mediterranean diet? My very favorite dietary pattern. And I think Sarah mentioned in the beginning, about that, because in 2000, I was hired as the Director of Nutrition Services at a cardiovascular hospital in Sioux Falls, South Dakota. And at the time, it was a low-fat, low-cholesterol diet was the dietary pattern recommended, right, by the American Heart Association. And so I thought, well, people are going to expect me to be the expert here. I better get over to PubMed and read a little bit about, what is the current research on diet and cardiovascular disease? Because you all probably know, by the time the ink dries on the paper on those guidelines that come out from American Heart Association, American Diabetes Association, by the time the ink dries, a lot of that research is always already out of date, right? Because new research has already come out. So that's what I did. I went to PubMed and I found the Mediterranean diet was the best dietary pattern for lowering not only the incidence of heart disease, but also the mortality from heart disease. And why? Because it was very potent and powerful at lowering oxidative stress. So then I go, wow, what's oxidative stress? So then I learned all about oxidative stress in the year 2000. And then here, just 2016, 15, I read this research paper by Dr. Paul and his associates, and they said that the Mediterranean diet is the most potent Nrf2 activator diet. Secondary, another dietary pattern is the traditional Okinawan diet. And it's because of all of the nutrients within these foods, within the Mediterranean diet, create a synergy, and that they activate the Nrf2 pathways. There's a lot of these nutrients individually are Nrf2 activated, but the whole overall dietary pattern is very potent. And so now to talk to you about the Mediterranean diet, what I'm going to do is I'm going to take you on a little photo tour of one of the food markets in Ortigia, Sicily. And my husband and I went on this tour. What is the Old Ways Foundation tours? I don't know if any of you have been on these tours. They're fabulous. The Old Ways Foundation educates on traditional diets, primarily the Mediterranean diet. So I went on one of their Old Ways tours, and it was a food and culinary tour of Sicily. And by the way, I was able to get 17 continuing education credits. So that was a good thing too, right? And so my husband is a professional photographer, and he had a blast taking pictures of the food markets in Ortigia. Sicily is where we took these pictures. And you'll notice fish, more fish. And a fishmonger that sings to you while you shop. The fruits, the vegetables, unbelievable, because they're just like fresh picked. Look at the dark greens, and this is really one of the really key nutrient benefits in the Mediterranean diet is from the greens. Parsley, particularly parsleying is one. Cruciferous vegetables. I didn't realize until I went over to Sicily how much cruciferous vegetables played a role in the Mediterranean diet. Tomatoes, of course, zucchini, eggplant. Look at that, like I said, cruciferous vegetables, the citrus fruits, berries, right? Olives, olive oil, nuts and seeds, herbs and spices. And that's my little photo tour of the Mediterranean diet. I hope you enjoyed that. Okay, back to the science of Nrf2, right? Okay, so we've talked about the Mediterranean diet being a Nrf2 activation diet. Next is fasting. And right now, a ton of interest in fasting and a lot of research. And there's different types of fasting: time restricted, eat, stop, eat. There's the 5-2 diet. And the research coming out is really showing that fasting isn't just a fad. It actually has science to validate it. It has health benefits, right? And one of the benefits of fasting is that it activates Nrf2. Now, if you look here, it activates Nrf2. And so far, if you've been kind of thinking about what Nrf2, all the benefits of Nrf2, right? You go thinking, oh, Nrf2 does that, Nrf2 does that, Nrf2. So you go, wow, yes, absolutely. They're believing that some of the health benefits of fasting is related to activation of Nrf2. By the way, my favorite type of fasting is a time-restricted fast where you fast overnight, because where you have a 13 to 14 hour overnight fast, like stop eating at 6, don't eat until 7, 8 o'clock the next morning, because that type of fasting synchronizes with your circadian rhythms. Really interesting research going on in that area of that type of fasting. I found this great research article on fasting, and it shows how Nrf2 can increase these antioxidant enzymes. This is heme oxygenase 1. This is another one called NQO1. And this research study was conducted, actually, it's a Chinese study. And these were surgeons that were performing resecting livers because of liver tumors. And what they did was that prior to surgery, they had some of the patients were on a 6-hour fast, and some of them were on 24-hour fast. And what they did was that they then looked at the Nrf2 activation and the increase of these two particular antioxidant enzymes in those that had the longer fast, the 24-hour fast. And you can very easily see that it was the 24-hour fast that significantly increased Nrf2 versus 6 hours, right? And look at the increase in these two antioxidant enzymes. Interesting too, they said that it also, the patients that had been fasted 24 hours or more actually had better clinical outcomes. And so their conclusions were that the Nrf2 signaling pathway may play a key role in fasting against inflammatory responses and antioxidant stress. Calorie restriction, Nrf2, cancer, and calorie restriction, another really interesting article on calorie restriction. And this was in mice, some Nrf2 knockout mice, and they found that when they knocked out the Nrf2, there was lower cancer protection under calorie restricting, suggesting that most of the beneficial effects of calorie restriction are on carcinogenesis is likely mediated by Nrf2. Wow. Wow. Oh, how about this one? How about Nrf2 activation and strenuous exercise? This one, the Nrf2 activator that was given in this study was sulforaphane, but what did they find taking sulforaphane prior to strenuous exercise? Reduced oxidative stress, increased endurance, and decreased muscle damage. Okay, so far we've talked about Mediterranean diet, we've talked about fasting. The next approach would be to take a Nrf2 activator supplement and increase Nrf2 activation specific nutrients. So what are some of these potent Nrf2 activator nutrients? Sulforaphane being the most potent and powerful of all of them, the single most potent and powerful Nrf2 activation ingredient. Resveratrol, quercetin, silymarin, that's milk thistle, turmeric, green tea extracts. Let's talk a little more about sulforaphane. Sulforaphane is found, of course, in cruciferous vegetables. The highest amount is found in broccoli sprouts. As you can see, they're up to 100 times more in broccoli sprouts than broccoli. Now, this is one thing to know about sulforaphane is that freezing, microwaving, and boiling destroys sulforaphane. So according to Elizabeth Jeffrey, she's a PhD nutritionist at the University of Illinois in Urbana, and her research found that if you want to preserve sulforaphane in broccoli, what you need to do is lightly steam it for 3 to 4 minutes. Okay, so now you know how to get more sulforaphane from broccoli. The other thing that you can do is you could increase the Nrf2 activation potential of sulforaphane by combining it with tomatoes. And they found that broccoli powder was slightly better than tomato powder. They're talking about how together broccoli and tomato powder were most effective at inhibiting cancer growth by an impressive 52%. So in this case, they used broccoli powder and tomato powder. I remember going to the Brussels sprouts booth at Fancy one year, and this is probably now at least, I would say 5-6 years ago. And I asked the Brussels sprouts, staff there at their booth, and I said, have you ever done any studies combining broccoli sprouts with other foods to see if you can increase the Nrf2 activation? And they looked at me and they said, well, yes, we have. Tomatoes. Okay, so if you want to increase your Nrf2 activation from cruciferous vegetables, lightly steam for what? 3 to 4 minutes and add some tomatoes. Probably tomato paste or tomato sauce would be even better, right? So I'll have some broccoli lightly steamed with your pasta and marinara sauce, right? Now there's a lot of research, there's quite a bit. If you go look at sulforaphane at PubMed, there's some significant amount of research on using it as a supplement. And there's a number of health benefits that they have found with sulforaphane. Now, there are other Nrf2 activator supplements on the market where these companies have taken Nrf2 activation ingredients. So we've talked about sulforaphane alone, right? Now, there are supplement companies have taken Nrf2 activation ingredients and combined them into a Nrf2 activator supplement. So I'm just posting here just 6 of some that I found when I did some of my research and some of the brand names. And then what I did is I went to PubMed, and I went to Google Scholar, and I did some research. I also went to their website and tried to find some research I could pull off the websites of these supplements, these branded supplements. 2 that I looked at, particularly were 2, because these are companies maybe dietitians are familiar with. One would be Zymogen and Pure Encapsulations. And here I've listed the formulas of these, and you can see what they're doing, right? Combining Nrf2 activation ingredients into one supplement. This was formulated by Dr. Perlmutter, I believe, and that's a nice combination, right? Unfortunately, there's not any studies on the formula, but we know all of those are individually our Nrf2 activation ingredients. This one too, again, not any specific research. Now, I really need to contact these companies again because I haven't contacted them for a while to see if maybe there's something out there and I haven't really seen, or maybe there's some research or even some white papers they might have on their formula. See, it's really interested in the formula. Protandim Nrf2 was the one that had a significant amount of research. In fact, there are 26 studies on Protandim Nrf2 when you go to PubMed. And this is a really backstory. There's a great backstory on Protandim. Because if you will remember, I talked about Dr. Joe McCord. He discovered SOD back in 1969. So Dr. Joe McCord went on this 40-year journey. His journey was to bring a Nrf2, an SOD drug to market. And he found, again, the problems with, of course, with SOD is the same as the problem with glutathione, right? Bioavailability, to try to get it biologically active within tissues. Not only that, most of the SOD drugs had too many side effects. It was in early 2000 that he switched gears and he started working with natural compounds. He started with 40, narrowed it down to these 5. And then he started conducting research. And then his research, first human clinical trial on Protandim Nrf2, found that it lowered oxidative stress by an average of 40% in 30 days. Now, he didn't know that at this point in time that it was a Nrf2 activator. It wasn't until 2008, and he continued to conduct more research. And it has a lot of, like I said, a lot of great research. And so what it is this combination of these 5, these are all herbal plant extracts in a very low dose, combined together, create a synergy. So this was a study done in 2008. And what is the on protandim Nrf2? And this showed that when you would take these nutrients, these extracts individually, you did get a little bit of an increase in heme oxygenase 1. That was the antioxidant enzyme that they were, they were looking at. But the 5 together in this formula called protandim Nrf2 increased the production of heme oxygenase 1 by 18-fold. So just really showing that this is kind of a little magical formula, this by protandim Nrf2. So not only does it increase heme oxygenase 1, protandim is in the studies has been shown to increase SOD by 34%, catalase 54%, glutathione 300%. And these are just kind of a diagram of some of the research institutes that have funded and conducted studies on protandim Nrf2. And the reason there's so much interest in this in the research and scientific community is because Dr. Joe McCord was well known in the research community. He's known as the father of free radical biology, right? Had already at this point published over 200 papers in free radical biology and antioxidant nutrition. So very well known. So this generated a lot of interest in protandim Nrf2. One study, this one over here, Biogen is actually the first biotech company to come out with a prescription drug, Nrf2 prescription drug. And Biogen actually did a head-to-head comparison between their prescription drug Tecfidera and protandim Nrf2, and they found that protandim Nrf2 was about twice as potent, significantly more potent than their drug as a Nrf2 activator. Now this to me is probably, I think, the most interesting study on protandim Nrf2, and really does kind of validate that activating Nrf2, lowering oxidative stress, getting this tremendous tons of cellular protection, right, by activating those antioxidant enzymes, what could slow down aging. And so this study was funded by the National Institutes of Health, and it was conducted by National Institute on Aging. Now, NIA has been for the last 20 years selecting different drugs and supplements, and they've been studying in mice. Of course, can't conduct these studies in humans, looking at the ability of these drugs and supplements to extend lifespan. Now, it's interesting that NIA, prior to studying protandim Nrf2, had already studied resveratrol, curcumin, green tea extract, fish oil, MCTs. None of these individual nutrients slow down aging, but protandim did significantly, extends lifespan and also health span, because the mice that were taking the protandim Nrf2 were also healthier. I talked a little bit about Tecfidera already for multiple sclerosis. There are 2 that I think only 2, I don't know of any others, that are Nrf2 prescription drugs. And I think what you're going to see too, as you see patients coming in your clinics over the years, you're going to see more and more patients on Nrf2 activation drugs. So we have Nrf2 activation for multiple sclerosis. The next one is Radicava for ALS. Right, because what? Linked to SOD, definitely. And then the Michael J. Fox Foundation is studying and researching Nrf2 drugs for Parkinson's. So stay tuned, more to come. So what is more potent? You're probably wondering. Okay, so we've got the drugs, we have sulforaphane, we have protandim. So how effective are these? And these little graphs, I think, are telling us a little bit more about Nrf2 activators as well. First of all, you can see that Nrf2 activators have a pulsatile effect. It would not be a good thing to get Nrf2 turned on all the time. That would not be good. But you can see that it has a pulsatile effect, and that taking more of the Nrf2 activator is not necessarily going to give you more Nrf2 activation. It's kind of like rate limiting. It's like your body increases Nrf2. It's like you get a feedback mechanisms and it shuts down the Nrf2 activation, right? So this is protandim Nrf2 up here, A. B is bardoxolone, a drug for chronic kidney disease. It has only made it through phase 2 trials as far as I know, and I know they have some problems with some side effects with this one. Well, here's Tecfidera C. And then this is D, this is sulforaphane. Now sulforaphane is used as the gold standard in measuring Nrf2 activation effectiveness. So as you can see, the drugs are about twice as effective, 2 to 3 times as effective as sulforaphane. Per-tandem Nrf2 is, I'm thinking 6 to 7 times more potent than sulforaphane alone. I think it just tells us about synergism, right? How the synergism of those extracts work together. Okay, so I'm winding down with my talk here today. And so if I can look into my little crystal ball and tell you like what is the future with Nrf2 activators. What I see is, again, you're going to see more Nrf2 activator pharmaceuticals, drugs, and you will see more supplements. And I think this may lead to the routine testing of oxidative stress in medical clinics because, you know, right now when you go to your doctor, they're not measuring oxidative stress. You have these patients with these multiple chronic illnesses, but they're not measuring their oxidative stress, right? And you might be thinking, why? You know, it's got to be off the chart. Well, because they don't have a Nrf2 activation drug to give them, right? But now that you've been to this webinar, you kind of have an idea that you as a nutrition professional clinician, that, you know, there are some things you can do. For example, I think that we're going to see more studies on food herb combinations. I'd love to see some of you here that are researchers. That I am not. I'm just a really interested party here at Nrf2. And I think that'd be very interesting if we could come up with some meals that have Nrf2 activation potential, like what would be the most perfect Nrf2 activation meal. So if you have these patients, all these chronic diseases, you could say, aha, here is a menu. Now, put these specific foods combined together, right? Wouldn't that be kind of cool? Well, we certainly know one meal that, I guess this would be the meal that I would say, fish, right? Fatty fish, broccoli, tomatoes, red wine. Why? Resveratrol. Why EVO, extra virgin olive oil? Because of all the polyphenols. Those are potent Nrf2 activators as well. So would that be like the natural Nrf2 food solution? You know, so I know my brain is just running away here. So anyway, summary. And this is my last slide, and then I'll turn it back over to Sarah for questions. And Sarah, you'll read off the questions, and then I will answer. Hopefully I have an answer. So summary, Nrf2 is a powerful anti-aging pathway providing what? Detoxification and potent cytoprotection. Why? Because it increases those production of those antioxidant endogenous enzymes. I tell people that those endogenous antioxidants are like our medications. They're like our pharmacies within our cells. Nrf2 is activated by what? Nutrigenomic nutrients, and we talked about those in plant extracts, especially in synergy, right? A Mediterranean diet, we talked about fasting, and we talked about some supplements. Okay, so with that, I'm going to stop the PowerPoint, and I am going to turn it back over to Sarah. And Sarah, you can unmute yourself, I think, there.
That's good. Yeah, thank you so much.
Ask questions, awesome. See if I can answer these questions. So
yeah,
fire away.
That was awesome. Okay, so first question on here for you is Nrf2 recommended for patients that have cirrhosis of the liver? If so, how often should they be on it?
Okay, so yes, you know, all of the Nrf2 activation is really beneficial for any kind of liver disease, liver problems. In fact, you know, phase 2 detoxification occurs in the liver, and you need glutathione for that. So, and we know that Nrf2 activation significantly can increase glutathione. Dr. Joe McCord said that Nrf2 activation is probably one of the best things you can do for the liver and liver health. So you could go to pubmed.gov and you can type in Nrf2 activation and cirrhosis and see what you find too.
So do you think that there's any conditions that would be counterintuitive that we would say not to recommend a Nrf2 activating
like not to recommend a Nrf2 activator supplement, something that would be potent at activating Nrf2. Right now, the conditions would be those who have had a solid organ transplant and are on immunosuppressive drugs for that, for solid organ transplant. Not probably for, if you have an inflammatory condition and on an immunosuppressive drug for that, probably I would say have the patient talk to their doctor about it. I have lots and lots of, in my networks, patients and customers on Nrf2 activation for different inflammatory conditions and also on immunosuppressive drugs. The other one would be during cancer treatment. There is this, well, especially during chemotherapy, because chemotherapy is a pro-oxidant. Right, so it acts by increasing oxidative stress. But there's some concern that if you have high Nrf2 activation, it could protect the cancer cells from chemotherapy. Probably, that is still an unknown. We really don't know about that. Certainly, I would have no concern about Nrf2 activation diet, especially since we know that like the Mediterranean, I mean, literally, you think about it, the Mediterranean diet is the most potent Nrf2 activation diet. What could be better for a cancer patient than to be on a Mediterranean diet? So I have to say we really don't know for sure on that. But to be cautious, that's a recommendation that I give.
Perfect. Okay, is Nrf2 recommended for long-term use or just for certain periods of time?
Nrf2 activation, according to Dr. Joe McCord, can be taken, if you're taking a supplement, Nrf2 supplement, it can be taken long-term. Especially if you look at those Nrf2 activator supplements, you'll see that the amount of the bioactives in there, nutrigenomic ingredients and nutrients, are usually in pretty low doses. Never really reach the level of pharmacological effect. So the way that those Nrf2 activator supplements work is that it's at very low doses in combination to create a synergy and activate Nrf2, right? So definitely, I see no concern with taking a Nrf2 supplement long-term.
Another comment was with the sulforaphane, doesn't that mean like 10 cups of broccoli sprouts to get that effect?
Yes, sulforaphane, that's right. When you're looking at comparing it to like the sulforaphane to Protan and Nrf2, yeah, that's a lot of broccoli sprouts, right?
So before the exercise comment. Okay, next comment here. Somebody says, is any particular wine better, since we're talking about Sicily? I've heard Garnacha or Grenache. I'm not sure if I'm pronouncing that right, but any particular wine or?
Yeah, oh gosh. I don't know. I'm not an expert in that one. That's a good question though. Yeah. I just enjoy drinking it. Anything red, bolder the red, the better.
Okay. Let's see. I don't see any other questions right here.
Okay.
What do you think? Any other ads you're thinking of that we may have missed?
Anything else that I might have missed in my talk about Nrf2? Oh my gosh, I could talk.
Here's one. How about you had mentioned the Nrf2 pathway being activated by the Mediterranean diet and fasting as well. Isn't it also the sirtuin pathway being activated with fasting?
Oh yeah, sirtuins. Okay, yes, I didn't talk about that. Yes, there's another. There are other very potent anti-aging genes that are activated with fasting and severe caloric restriction, and that would be the sirtuins. There's 7 of them, and of course sirtuins need NAD, in order to be activated and increase into function. So a lot of interest and a lot of research going on in that area of sirtuins and NAD as well. So you probably have already read or know about that, some of you. So yes, that's another one. Good questions, by the way. Good job on the questions. Anything else, Sarah?
One other one says, so aside from Nrf2 and supplements, other natural sources, ? Any herbs or greens of any kind, which I think you kind of mentioned the Mediterranean diet and synergy.
Yes.
But any greens in particular you can think of?
Hey, Sarah, how about if when you send out the certificates, maybe I'll send you the full text of that study from Washington State University,
Yeah.
because in that study, they list all of the individual nutrients in the Mediterranean diet and in the traditional Okinawan diet. So you can see what specific nutrients are very potent Nrf2 activator ingredients individually.
Super.
So that maybe you guys dietitian could start putting together some Nrf2 activation meals, right?
Yeah.
I know there's a lot of smart dietitians on this, so you'll figure it out.
That sounds awesome. Yeah. So as Joanne just said too, as just as a reminder, I'll send out to you guys the CEU for your credit that you'll have to keep on hand for your credit that you want if you claim it. And then a couple articles she mentioned for the Nrf2 article and the Washington article. Also the recording for 10 days that'll be available.
Yes.
And then you guys can let us know if you have other follow-up questions with that too anytime. But
thank you, Sarah, for inviting me to be on today. Really,
thank you.
really,
So
I always love talking about this
much.
subject. So
You are just like a load of wisdom, and we just so appreciated your time. And
you're welcome. You're welcome. Bye-bye, everybody, and God bless.
You guys.
It's been great. Bye-bye.